Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. What are the conditions needed for myolysis to be done? The first and foremost thing is age. If you're someone who is experiencing fibroids in their teenage, remember that myolysis should be done only after 18 years of age. Second thing, symptomatic fibroids. What do you mean by symptomatic fibroids? Some certain section of people, even though they have fibroids, they do not experience any sort of disturbing symptoms. But some people do experience symptoms. And what are these symptoms? It can be prolonged bleeding for more than 15 days in some people. It can continue up to 1 or 1.5 months in some people. Or even if they're bleeding for 5 to 6 days, the amount of the bleeding or amount of the menstruation blood that is coming out can be more. There can be clots that are passing. There can be pain in the hypogastric region, which is, pressing on to the back. There can be pain in the hypogastric region, which is, radiating downwards or extending downwards into the anterior part of their thighs. There can be pain in the lower hypogastric region where it is bearing down kind of pain, whereas someone is putting a hand in your hypogastric region and pulling the organs down. You have this bearing down kind of sensation. Or if you're having urinary tract symptoms like urgency in urine, or if you're having constipation symptoms, all of these symptoms come under fibroids. How is constipation and urinary tract symptom of fibroid? Because fibroids can cause pressure symptoms on the anterior part, which can lead into urinary tract symptoms, or on the posterior part, that is back part, leading into constipation. If you're having any of these conditions, you can get myolysis done. Apart from that, uterine volume. If the uterine volume is more, that is if they have bulky uterus, or if you're pregnant, 18th week, 19th week pregnant, or even if you're conceived itself, you should not be getting a myolysis done. Next, alternatives to myomectomy. If you're someone who is having multiple fibroids and you have to get it removed, then myomectomy might take a longer period of time compared to myolysis. So you can get myolysis done rather than myomectomy. Apart from that, multiple intramural fibroids, as we've already mentioned in the alternative to myomectomy topic, where if you're having too many fibroids, then it will take a lot of time for myomectomy to be done. So fibroid removal through myolysis can be much easier process. And then other medical indications. If you're someone who has to have a uterus, like for example, if you're planning for pregnancy, or if you do not want your uterus to be removed for hormonal imbalance, you want to keep it under control, and because of any other reasons that they cannot do a major hysterectomy or major operation on you, you can suggest myolysis for these kind of people. If you're someone who's suffering from fibroids, adenomyosis, endometriosis, PCOS or PCOD, or if you're someone who's suffering from bulky uterus, dysmenorrhea, Bartholensis, any of the female reproductive organ diseases, you can contact or you can choose Fidicus Homeopathy, as we have high success rates. Here we have two kind of consultation options. The one is the online consultation option. The second one is the offline or the in-person consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying far away from the nearest branch of Fidicus, you can contact us online through audio consultation options or through the video consultation options. And after the doctor consultation has been done, we will ask you for investigations, whatever are needed for your condition. And if you've already got those investigations done, you can share it with us. After this whole procedure is done, especially to the online clients, we will be delivering you our medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. If you're staying anywhere else across the globe, it can take 4 to 8 business days. We're mentioning here clearly it will take business days because holidays and other things are not included in this. Particularly 3 to 4 business days is what we are proposing. If you're someone who are suffering from female reproductive organ diseases and you would like to get in touch with us, you can call us on this number. You can WhatsApp us or message us on this number. If you're someone who wants to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from fibroids, if you're someone who's suffering from endometriosis, adenomyosis, or if you're someone who's suffering from bulky uterus, dysmenorrhea, PCOD, or any other female reproductive organ diseases, and you would like to choose homeopathy because we've told you how homeopathy works best for all of this, why should you choose Fidicus Homeopathy apart from other homeopathy doctors? Remember that Fidicus Homeopathy stands for highest chance of health. Here, compared to other doctors in homeopathy, we have highest success rate. We have top-notch doctors and we are treating it with high success rate. First thing. Second thing, we have transparent treatment. What do you mean by transparent treatment? We do not have any gray area between the patient and the doctor. Here we will be talking to you about your prognosis and also about the condition of your fibroids also, and also the personal care here at Fidicus is top notch. So if you want to choose health, if you want to choose cure, if you want to choose a doctor who is going to address all of your issues, answer all of your queries, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.